Can you have plants in your home during ASCT? Pets, anything to avoid when returning home after ASCT?
Our patients is to have the transplant process be as minimally impactful on patients' lives as is possible, given the constraints of what we're actually doing for patients. And for that reason, we have a fully outpatient transplant program at Moffitt. And the overwhelming majority of our patients, over 2/3 of patients, never get admitted to hospital. We see them very carefully, we watch them very closely, but we try and maintain some degree of normality as much as possible for them going through the transplant process. Our recommendations are for patients to have their homes as clean as possible and to engage in sensible practices. But when it comes to house plants and gardening, our recommendations are they can have plants inside their home, but not to engage in digging in the soil or liberating the soil in any way, because the theory is that that might liberate things into the air, into the atmosphere that they could breathe in and put them at risk from that perspective. We ask them not to engage in gardening in the first 90 days after they have their transplant, because again, for that same reason, digging around in the soil is potentially going to liberate molds and things that we don't want them breathing in. When it comes to pets, there's certain pets that we ask them to remove from their house in that first initial period. And those are usually birds, exotic animals, things like that pose an additional risk. But when it comes to cats and dogs, we want them to have their loved pets in their environment as long as they engage in safe practices. So usually we ask them not to pick up after the pets, to have scrupulous hand hygiene if they're rubbing their pets, to not to allow the pets to kiss them in the face and lick their face in that period. But the pets don't have to be removed from the home. We try to have those things that are important to patients in their lives present as long as we can mitigate and minimize those risks. Now, obviously, institutional practices can vary from place to place, but that's our practice at Moffitt.
Okay. So this is an excellent question. And the answers are somewhat operator dependent. Different physicians feel a little bit differently about this. I was one of those physicians that used to feel that post-transplant patients should stay away from their pets for 3 months at a time. And I don't necessarily feel that way now, but I do feel certain basic guidelines are important. For instance, I would suggest to patients that it is important not to clean up kitty litter or to take the dog out for a walk. I would tell them to be careful about being scratched by animals. I don't necessarily feel strongly that patients have to house their pets somewhere else post-transplant. I feel that during the transplant period, it's most important to be safe and keep distance from anything that might be a focus of infection. I think it is good to have a clean home environment, but I don't think patients necessarily need to stay away from their houseplants and so on. We do tell them to be careful. Try not to clean out the attic, try not to clean out the basement. If you're going to be out weeding things or out where there's a lot of fungus and so on, that you might want to be careful and wear a mask and take common sense precautions. But with respect to animals, I think the paradigm is changing over time and people are becoming more liberal about how patients can interact with their pets. Still, it's important to be careful, stay away from litter, stay away from poop, and patients, you should manage to stay safe in that setting.
I think your pets are really important. And I think that having a person needing to stay away from their pets when they're back home is probably almost impossible. I think that I think the post-transplant time is a lovely time to defer litter box duties to somebody else and give yourself a break from dealing with the pet waste directly. But I think that you're going to be with your pets, and I think that that's an important thing to remember. I think that houseplants, a little bit of, like collecting your tomatoes from the garden and things like that is probably fine. Anything where you're really in the soil, digging a lot in the soil, where you're at risk of cutting your skin and injuring yourself is something that is probably better to avoid for a few months after a transplant. It makes sense if you know your pool. And if you have a sense of whether you feel that the pool is maintained well. Some people really do enjoy going to the pool, and I often suggest that they just call and they ask, what times of day is it much less crowded? Not necessarily because of the pool itself, but because of the changing rooms, and the areas around the pool can sometimes be really packed, and you perhaps want to have a little bit more breathing room around you.